Prognostic awareness, or simply understanding the likely course of one's illness, can be life-changing for people with cancer. But how does knowing, or not knowing, the truth about one's prognosis affect emotional well-being? A large systematic review has now shed light on this deeply personal question by analyzing how being aware of the prognosis influences anxiety, depression, and quality of life across different stages of cancer. This review included 54 studies with over 13,000 cancer patients and looked specifically at how prognostic awareness, called PA for short, relates to psychological outcomes at 3 stages: early, advanced, and terminal. Let's start with the main finding. For patients in the terminal stage of cancer, more than half of the studies, 53%, found that being aware of the prognosis was associated with lower anxiety and depression and better quality of life. In contrast, only 9% of studies with patients in the advanced stage and none in the early stage showed the same benefit. In other words, for people nearing the end of life, knowing what to expect can actually bring peace of mind. But for those earlier in the illness, the truth may be harder to handle. So why does awareness help some people and hurt others? Researchers found that several factors shaped how awareness influenced well-being. For example, patients in hospice care, where the focus is on comfort, benefited the most. All studies with hospice patients showed favorable outcomes from being aware of their prognosis. The same was true when people had less than 60 days to live or were older than 65. In these situations, understanding the prognosis allowed people to prepare, find closure, and avoid unnecessary or aggressive treatments. Cultural differences also played a role. In Western countries, 80% of the studies with terminal patients showed positive outcomes from prognostic awareness. In Eastern countries, the rate was only 40%. This highlights how beliefs around death, communication, and emotional expression vary between cultures. Interestingly, the review also found that gender and marital status made a difference. Male patients and those who were married were less likely to benefit from being aware of their prognosis. Researchers suggest that men may be less likely to talk openly about emotions, and married patients may worry more about burdening their loved ones. One of the key takeaways is that prognostic awareness is not one-size-fits-all. Some people benefit, others may feel overwhelmed, and even the way awareness is measured matters. Patients react differently to being told they have 6 months to live compared to learning their disease is not curable. The emotional weight of the words really matters. So what does this mean for patients, families, and healthcare providers? It means that communication about prognosis should be personalized. It should be handled gently, with empathy, and in ways that match the patient's emotional state, culture, age, and wishes. When done right, it can reduce fear and suffering and help people live their final days with more peace and clarity. The research also shows us that it's never just about giving information. It's about helping people understand and emotionally process what that information means.